Well, hello and welcome to Dementia Unplugged Care Conversations. I'm Jeannie Forrest and I'm the host. And today we're going to be talking on topic with someone who is living with dementia. So the title of today's interview is Lessons I'm Learning as Someone Living with Dementia. We are thrilled you're here to join this important interview, and I'll introduce our guest in just a moment. Before we get started, I want to read this note from the Dementia Society of America. All content, including any potential medical information, is provided as an informational resource only and is not to be used or relied on for any diagnostic or treatment process. It should not be used as a substitute for professional diagnosis, care, and treatment. Please consult your healthcare provider before making any healthcare decisions or for guidance about a specific medical condition. The opinions expressed and the content shared by me, Dr. Forrest, and my guests are not necessarily the opinions and content of the Dementia Society of America. Thank you. The way I usually like to get started is just a brief overview so that people know a few highlights about the word dementia. The word dementia is considered sort of an umbrella term. And underneath it, there are a wide variety of different, what we call subtypes or conditions that, that present itself as what we call a dementia. Just like the word cancer, there's many, many different types of cancers, bladder, breast, bowel, lung cancer, similar to the word dementia. And so you may be more familiar with some of the subtypes like Alzheimer's disease or vascular Lewy body, and it can be mixed, frontal temporal, and the list goes on and on. It's important also to know that dementia is not considered a normal part of aging. And so there are various changes that people experience, perhaps in different order and intensity, but it can also involve not only thinking skills, but mood, motor skills, language. Just wanted to kind of give you a brief overview. There are some conditions that are reversible, but unfortunately, many at this point in time are not and are progressive and terminal in nature. The Dementia Unplugged Care Conversations is just one of three different Dementia Unplugged programs. So today, the first Monday of each month, I talk with either caregivers, researchers, innovators, people living with dementia, all doing a variety of what we call good work in the dementia community. You should also be aware that Dementia Unplugged also has musical connections. And this is looking at the power of music. And it takes place on the third Monday of each month. And there's sessions held with brain scientists and performers and looking at the benefits of particularly personalized music. And lastly, there's Dementia Unplugged Artful Insights. This is a conversation that looks at selected works from museums around the world. It's considered part of a life enrichment program. And that happens on the fourth Monday each month in partnership with Arts Philadelphia. So we hope you will keep your Mondays open for these wonderful programs. Before I introduce my speaker, I do want to let you know that generally the format is that I will talk with Gary Howard in this circumstance for about 30 minutes and then open it up to question and answer. And you can find that through the chat button. And that'll last for about 15 minutes. All of these sessions are recorded, and you can see the pre-recorded sessions if you go to the Dementia Society of America website. So let's welcome our guest, Gary Howard. He is our National Dementia Aware Advocate. Just a brief background, especially if you're listening in. Gary was born in Lancaster, California. And after graduating high school, he joined the Los Angeles County Fire Department. Gary is promoted to captain of the ranks while still keeping his paramedic license. And he has a BS in anatomy. You can follow Gary through his Twitter handle. So we are thrilled that he's here. And so now I am going to stop sharing my screen so that we can see Gary and start our interview. And welcome, Gary.
Hi, Jeannie. Good to see you.
Good to see you too. Thank you again for taking the time to speak about your experience and your journey thus far with the listeners for Dementia Unplugged. So before we get started, I thought maybe, I gave a little brief sketch of your background, but maybe you just want to tell us a little bit more about yourself and your family.
Sure. As you stated, I'm from born and raised in Southern California, in Lancaster, which is the desert community up in northern Los Angeles County. My wife and I actually now live in Findlay, Illinois, a little bit of a culture shock there, in central Illinois, which is down the road from Jeannie. And at this point,
quite a bit down the road. Yeah.
3 hours. Yeah, quite a bit down the road or up the road, depending, I guess. But I have two sons. I have a 15-and-a-half-year-old. And yes, I am starting Xanax for that shortly. He has his learning permit now. And I have a 13-year-old, both boys. So I'm busy there too.
Thank you.
And my wife and I have been married about 17 years, and she's a RN also.
Thank you for that. And your background is as a paramedic, correct?
That's correct.
Okay. All right. So let's jump into it. So here you are, you're working. And if you don't mind me asking, how old are you, Gary?
I'll be 61 in August. I'm 60 now.
Okay. So take us into what was happening, or what were you seeing or others seeing that maybe you weren't, in terms of perhaps warning signs? Or
Sure. Actually, I saw nothing. I didn't have a clue what was going on. I just thought anything was typical of what you see, when people get older. And I was getting older and I retired. So, of course, I wasn't using my mind as much as I used to. So I added all those up to just the way it goes. And I was at a fire department function here in central Illinois, and I was asked to do the prayer. And when I was done, as we were on our way home, my wife looked at me and said, "Do you know you repeated yourself about 15 times in that prayer?" I said, "Oh, not only did I not realize that, but I thought, now I know why the prayer took so long, it seemed like, because apparently I did repeat myself. Everybody was commenting as we got into this and started asking, and I had no clue. To me, I didn't realize it, or I didn't notice it, or maybe I was doing it for so long, I don't know. That nobody has the answer to that, but that's how it all started. And then it just went into medical, and it's been quite an interesting process.
And remind me about how long ago was this prayer?
I got the issue where I started repeating myself. This was in about early 2019.
Okay.
I'm sorry, late 2018, because it would have been around Christmas time. And then going into 2019 is when all the testing started.
Mm-hmm.
But that's how it started. If my wife hadn't said something, or if she hadn't been with me knowing what I normally do and don't do, and that's also when she realized, you do that all the time. And
so in retrospect, that was sort of a catalyst, but was she then able to say, this is a pattern that I'm seeing more?
Absolutely.
Was it that she just didn't think it was odd, or this was just you?
Well, her explanation to me, which was logical at the time, she said, given my age, given that these things are all very, if you look at an algorithm for any type of dementia, these are all the warning signs. And then she said, what did it with her was actually watching me do that in public, because you always notice when your spouse is doing something. And she said, I paid attention to you and realized how many times you repeated yourself. And then she said, I started thinking you do that every day, all day. She goes, you'll tell me something on the phone at 8 a.m. By noon, you're texting me the same exact cotton picking thing. And so she started putting it all together. And that's when she got me into the neurology unit, and it all went from there.
Got it. Okay. Which is a very common experience. We often assign a lot to age, and we know that this is not, quote, normal part of aging, but unfortunately there's still a lot of ageism, thinking this is just, well, that's just part of it. And I'm hoping that at least our talk today will enlighten some others to realize, no, this is not really what should be happening. So that's it.
What I compare it, Eugenie, is this: in medicine, you've been in it your whole life also, and especially in emergency medicine I've been in. If a woman calls you and it's a chest pain call, it was never taken very serious. And I hate to say that, but let's just call it what it was.
Yeah, you're right.
Now, as we've made recognition that women 2 out of 3 times when they end up calling with chest pain usually end up with a stent. So, we've now realized all these things that took us all these years to learn. It's the same thing with dementia. Oh, you were too young. First thing I got told, first thing the PA told me, oh, you're too young. You're worried for nothing. Okay, that could be true too. I don't know. I knew nothing about it.
Walk us through sort of, okay, this happened, and then what did you, so tell me, you went to see the neurologist. Sure. So what was that whole very diagnostic piece like for you?
I met with my doctor, who she is an amazing neurologist here in Central Illinois, and did the whole, you do the formal testing and they ask you all the questions and then they repeat them to you, you repeat to them, these type of things. For example, the one that I had the biggest problem with, that I kind of remember having trouble with, was they give you 5 items, talk for a few minutes, and you'd have to repeat 5 items. I couldn't get that to save me. I don't know why. I'm not sure what's connected to what with that, but that was a big one for them. Okay. And then my neurologist, of course, sent me for EEG and all the basic stuff you do. And then, of course, all the blood work and everything that goes with it. And her comment was, nothing shows up abnormal. That's what really bothers me, because you have these symptoms that you shouldn't have. Well, in talking to her, I used to have episodes where it would be like an absent seizure. It takes me a minute to find my word. Mm-hmm. She saw that and she said, there's something wrong. Yeah. So they sent me to the bigger hospital in Springfield, Illinois, where I did a 5-day absent seizure testing and a couple other EEG tests where you're in hospital. Then, of course, MRIs, CAT scans, you can imagine all that's done. Then they look at the shrinkage value, as we all know how that works. Mm-hmm. And they decided there was shrinkage value. And then it all started. Got it. So that's kind of how I ended up being, quote, diagnosed through all the processes.
Got it. Thank you. Appreciate that. So let's talk further. During this, let's start with the bad. What has not been helpful from other healthcare providers in this experience? What would you say?
The age
This is
discrimination.
what you want to avoid.
Yeah. Age discrimination is going to be the first thing.
Okay.
And I, of course, like with everybody else, think, oh, that's not going to happen. I know how healthcare works. I've been doing this for 40 years. Meant nothing. Truly, one of the first things they said is, oh, it's if it's not an absence seizure, but it's your age, you can't have anything with dementia. Not humanly possible. That's when I ended up getting a neurologist who turned out to be an amazing woman and who's done a great job with me. And I mean, I don't think there's a test I haven't had, at least when it comes neurology wise. And, you know, she finally said, okay, here's where we're at. This is what you got. You're probably at this stage and you're going to have these stages, and here's your medicine. And we're going to try to do what we can do, which is all we can do.
Yeah, did find this person. So ageism is what we want to avoid from not only professionals, and what was not helpful perhaps from friends and work colleagues. What was not helpful? We'll start with that, then we'll go on to what was helpful.
Glad you asked that question. Most people don't ask that one, but that's a good question, because what's not helpful is they're not understanding that because of your age, you do have this disease. They expect everybody with dementia or Alzheimer's or frontal lobe or whichever version it is, as you and I both know there's many. But when it comes to dementia, they're expecting you to be some 90-year-old person that doesn't have the capability to still walk or drive or communicate correctly. And that is the biggest discrimination right there. Yeah. It can happen to anybody, but the age, you got to stop looking at the age. That's why we call it early onset, as you know. So we got to stop looking at the age. And I think in both cases, you need to really stand up for yourself.
Thank you.
I mean, really. And I was lucky because my wife works at the facility, knows the people. So I won't fib. I'm sure I got a little extra pat on the back, but I was just blessed that way. Yeah. But, you know, again, you never really know, but age seems to be something that I've noticed all the way around.
Okay, good point. Good lesson. So who's ever listening in, watching, please keep that in mind, to not let age be a discriminatory factor. So how did your colleagues, so you've been working still as a paramedic or not during this time? So you retired, but
I retired from Los Angeles County. When we came out here, I was a volunteer here as a paramedic for several years. And then once I got diagnosed, I did not feel comfortable practicing, and I wouldn't do that. So I've let it expire. And it's just not safe. And why would I subject somebody to that? What if I couldn't remember what drug to push? Yeah. I just don't know.
Mean, that makes total sense.
Yeah.
But unfortunately, some people without the lack of insight, as you are aware, make it even more challenging. But you do have that function of insight, understanding sort of safety issues and non-safety issues. So that is a blessing. So what has been, what would you say, helpful responses from family and friends? What has been the most encouraging for you to live with this in the best way you can?
Well, again, I'm blessed to have a spouse who's in the business, so it really makes it a lot easier because she gets it. The boys, they're raised up around it, so they get it. They've heard it. They've been rubbed off on them, so they kind of have a medical aptitude about it. It's basically just not treating you any different, but letting you know if they see something, because your doctor needs to know that. Mm-hmm. And it's not a one diagnosis. You go in, you see them, they give you your medicines, you go back in 3 months, whatever your insurance requires. It's not that you're going to change every time, possibly. You've got to really have a neurologist and whatever you have to take care of you with that. Mm-hmm. Because you will grasp for words. A lot of people also, one of the biggest things is, well, you don't look like you have dementia. You're perfectly fine. It's like with people that have chronic illness. What's inside, you don't know just because you fake it on the outside. And I do that a lot.
So what would people, if you don't mind sharing, what would people not know in this interview? What are the most difficult challenges for you right now?
Well, I'm having to write everything down now because the short-term memory has really been affected. And I have a lot of word grasping. So they have sent me to speech therapy, got some good information there. And they did a couple of swallow tests, make sure there wasn't something anatomical. And because, as you know, it can get on the brain and it can cause throat problems. So they're just trying to be very thorough. I'm very lucky that way. But also, I'll grasp for words. And that's just something that you really you kind of have to deal with that.
So, okay. Got it. So the most challenging at this point is keeping sort of track.
Keeping track.
And you're using notes. Are there other mechanism or devices or strategies that you find useful?
For me, the easiest way I've done it is everything that has a time for a task, I'll just set it up in my phone. I'm still an old school Android person, so it's easy to work. And everything goes off in alarms. And that's been the only way that I've not missed anything important or made a phone call I should have made or something like that, because sometimes you don't know. And the biggest challenge is that you can't do anything about it. That was my biggest problem. I wanted to fix it. What do you mean?
Especially being a paramedic by background.
Exactly.
You were there.
That's
put in that IV.
There you go. And that's what you want to do, and you can't. The second best thing that happened to me was you guys here. When I got a hold of Kevin, which was purely by accident, I was just searching on information because I knew absolutely nothing. I don't care what I've been doing for a living. And came across Kevin's info. We exchanged emails, and now here we are. But Dementia Society has made it easier because you can connect with people that have the same issues. And that's a big deal.
Yeah. And what I'm hearing, and not to scare people out in the audience, but here Gary's a paramedic for how many years? many. And, we've talked before that he had very limited education and training at all in terms of interacting or figuring out how to approach people with dementia. So we've got a lot of work to do, folks.
We do. We have a lot of work to do.
Yeah. Gary, I mean, there's a question that popped up rather quickly here, so I'm going to have you answer it. Did you have snippets of something or not seeming right prior to diagnosis? Were there other smaller incidents that you can look back in retrospect and say, something wasn't quite right, even more than the repeating of yourself? Were there other changes in behavior or thinking? That's the question. Before that prayer time.
Well, as you just said, I didn't think about it until I looked back. And I had noticed issues where I looked at some of my handwriting or like filling out a check. I had noticed that because I'm the stay-at-home dad, being retired when mom still works, so I did the finances. And I got to the point where I was sending $1,000 check for $100 bill. Of course, they credit you. I forget who it was. But I mean, we started noticing these little things and then said, oh, now that starting to make sense why we did that or I did that, or that kind of stuff would happen. You would get little snippets like that and it would show back up to you now that it made sense. Before you didn't think anything about it.
There was no context. And that difficulty with abstract thinking, particularly numbers.
Oh, yeah. Numbers are bad.
Kind of low, right? Those are the changes that start to take place. So thank you for sharing with that. So how do you spend your time these days? I mean, how do you stay engaged? People might ask, are you doing any special exercise, eating anything? I mean, I'm going to anticipate some of those questions, but I'll ask that up front. What
Okay.
is it that you're doing now?
Diet wise, I haven't really been given anything specific. I mean, you can look up all kinds of information on different foods, and I don't have any way to know which way they would work for you. I stay on my medication, which I believe, and maybe it's in my head, I do believe it has slowed the progression down, only because I notice things that I can do all the time now that before I thought maybe might be interrupted. So I've noticed that with the medication. And the other thing is I do at least one crossword puzzle book a day.
Wow.
And the reason I do that is because I don't have any medical requirements to think. I don't have any, I mean, my teenagers pretty much take care of themselves. And it's not hard to do laundry and keep the house vacuumed. So that's how I engage myself. Yeah. And I still drive, so I do have, chores and stuff for the house, but the driving will probably come to an end probably within the next year, the way I look at it.
Okay. I love it. People are sending in some questions in as we're moving on. Has your family received any training on how to best communicate with you or to show you love and respect? Has there been any support systems brought in for your family at this point?
Well, we actually have the accessibility to go to EPA, and which is part of the employee package of where the wife works. And of course, we went there initially when we got the diagnosis. It was about 8 sessions. We met with a therapist, very, very nice young lady, dealt with PTSD a lot. So this kind of, I think, was her groove, the way I understood it. We went there and they talked about, what to expect and all of that. Of course, wife having the background, it helps. So, yeah, I mean, they were very involved. We did do some counseling. We did do some wonderings, that kind of thing. But at this point, we're just kind of letting it, I mean, they're on my side. They just know, for example, to give you an idea, like the boys know to check and make sure I don't leave the oven on. The boys know to make sure that I, shut things off that maybe I didn't, or I would normally not. Because the stove was a big one. I was leaving that on for hours at a time. I got really good tests with our smoke detectors. I mean, it was crazy. But so they're trained to do that and they know what to look for, which does make a big difference because they're home with me all the time.
Okay. And they're teenagers.
Yeah.
Yeah. So that could go either way. I mean, kudos to your children. And
they do. They
system.
worry about dad, and I always tell them don't make a big deal out of it. But if you see something, we'll take care of it. But I don't want them to feel like they need to be my caregiver either. So you have to watch that.
Yeah, it's a fine balance.
Yeah, it is. And I don't want them to feel like, oh, now we got to take care of dad. Well, no, they don't. It's not like that. So. Mm-hmm. And I do have a medical alert alarm, that type of stuff. And of course, our fire department here is so small, everybody knows everybody. So, if something did happen, I would have help really quick.
So what was it like with your colleagues, your paramedic friends, when they found out, or I'm assuming they
yeah.
How was that received, or how, just in terms of that whole environment, what was that like to share the diagnosis? And
well, it was interesting. I had a Zoom meeting at one of the union meetings they have every 6 months, and we were kind of talking about what had happened to me and how I got there. And of course, half were the old, well, you're not old enough, and then you go into the whole story. And I remember now, I'll probably get a bunch of hate email, but in the field, we're just not trained with dementia patients. Now, if you want to have a car go over a cliff, we're your people, but we just are not trained with that. I mean, we get some training. Some people may have been CNAs or, LPNs before, maybe worked in a nursing environment. So there's things that may be your advantage, but to be taught out of our books, it's just not in there. And I know people get mad when I say that, but it's just not there. I know, I read many of them and it's just not there.
So you can understand perhaps when things don't go as well, when there are paramedics, or we know sometimes even when law enforcement is brought
Yeah.
in, and some of the difficulty, because there's just typically not part of the training. So
It's
education and
just not.
awareness, sensitivity is so, so important. So if any of you are on the call and listening in, and if you have any sphere of influence in this regard, we'd love to talk with you and see what we can do to provide some further education. Um, okay, thank you, Gary. So where would you say you find hope? Because there's some people would say, "Oh my goodness, I've got a fatal diagnosis, a terminal diagnosis, and you know, uh, life is just that's the end." What keeps you going?
Well, it's funny because I occasionally think about that, but to me, I don't think of it as a terminal diagnosis, even both we all know it is. But there's so many things along the way. I have had some medical problems aside of the dementia issue. I've had 3 major back surgeries, and that initiated from falling through a roof, being injured. But they've been repaired, and now I'm on a good track. But I mean, I went through that for years. I also have a circumflex issue in my heart that makes the vessels basically in reverse session. So if I take certain beta blockers and so forth, I can have an actual spasm in the chest cavity, and it becomes very interesting. It's not a heart attack, but it treats like one. So I've had some medical issues. And with that being said, you just kind of look at it as, I already got these medical issues over here. Now I've got this new medical issue that's long term, but really, I'm almost 61 years old, but I'm feeling pretty good about it. I mean, it's just I take it as it comes, take my medication, and when it changes, it changes, and when it doesn't, it doesn't.
Okay.
I think I've got a long time before I need to worry about that.
Absolutely.
And you never know what they'll come up with.
No, you're right. There's a lot of work being
Oh yeah.
done, and absolutely. So that's also part of the hope. So I know people have been sprinkling in questions throughout, but I'm going to now encourage anyone to send other questions through the chat function. Perhaps there's an area you'd like to know a little bit more on how Gary is doing with this. Oh, here's a question. What medication are you on?
Oh, I wrote that down because I knew I would never remember. They started me on Aricept, which I'm not sure, but I believe that's the primary go-to. Jeannie would know more than I'm not real familiar with them. And that one didn't work for me in an intestinal issue. So they switched me to galantamine, and I take 2 of those every day. They're 8 milligrams, so 1 in the morning, 1 in the evening. And then they've got me on minotanine. That's 10 milligrams, and that's also 1 in the morning, 1 in the evening. And then they've got me on some herbal things that are just basically over-the-counter stuff like zinc and, vitamin D, that kind of thing. But those are the 2 main prescription medications right now.
Thank you, Gary. So yes, and so it's good to hear that you find, in terms of your self-awareness, that right now it's at least maintaining or slowing down the progress. We know that these medicines work in about 50% of the people who take them, and you happen to be on the positive side.
I think I got on the good side of it because I can tell the difference. And as you know, yes, we know it's 50%. So of course you never really know. But I can tell the difference just in the simple fact that how long it takes me to get somewhere now is a good thing versus where you don't want things quickly, obviously progressing. Now it kind of tells me where I have stayed at. The only thing I've never been able to figure out, and I don't know if there's a formula for it, but I don't know when to tell my short-term memory takes over and when my long-term memory takes over. Because people will say, well, how far back do you remember? It doesn't work that way. You have to give me an incident and see if I can remember it. You can't just say how far back can you go. It won't. I can't figure that out. I'm not able to do that.
So tell me more about, are you integrating anything? We talk a lot about in the Dementia Society of America, the importance of the arts and music and things like that. Are you integrating or engaging in anything like that at this point in time?
I do pay attention to the arts because I like the visual, and that makes a big difference. The other thing I do is exercise every day. Not only do I need it just because I'm a lot bigger than I used to be when I was a fireman, but it engages your brain, the serotonin and all the medications. I'm also on depression medication, which they added that about 6 months ago. I guess there were some signs my doctor saw that he didn't want to have to deal with later down the road, thought we should try something. So that's fine. Like I said, I'm blessed to have a lot of really good doctors. I'm really lucky. They listen, they pay attention, and we all know what that's like. So from the working side and from the being patient side, we've all been there. So those are things to remember.
Is there anything on, I don't want to say existential or spiritual side or faith-based side that's important to you?
Yeah, we're relatively religious family. We, of course, 10 services. We actually are in the church. We deal with the church. Boys go to the teens thing and they help out there. So yeah, and I've always been a big believer in God. Always have been. Always will be. I know that He has saved me on more than one occasions and fires. So there's just no way I would be here otherwise. So I think that has a lot to do with it too. Is I just know that it's not a death sentence. It's like cancer. Trust me, cancer is the worst thing in the world to me. I've watched so many die from it. But just because we get the diagnosis, let's calmly, so we don't miss something, let's calmly move on and see where we need to be and find the right doctors. That's the biggest key. Find the right medical people right there. That'll get you the best treatment right there.
Yeah. Sort of stepping back, not sort of freaking out right away, because we all hear the horror stories.
Yeah.
But I think a message here is that life, you can have a pretty darn good quality of life.
Yeah, sure.
And even with younger onset dementia, this is the sign of hope.
You have to hit it head on, though. You can't sit in your chair and say, "Oh, I'll talk to the doctor tomorrow," or "I'll talk next week." Find the right medical person. And I know that Jeannie knows all this, being a nurse so long, but find the right medical person through somebody if that makes you feel better. Or, find it through your, maybe your church has some people they know. Anything that can get you the right medical people, because they're going to be the ones that are long-term for you. That's where you need to start.
Yeah. That social support and that networking. Quite often what I see is there still can be a stigma associated.
Yeah.
And there is this fear that keeps people from wanting to know more. And so not wanting to know anything, people then try to figure it all out on their own. And that's often when I get the calls for support when there's a crisis situation, when it's too late, not too late. It's never too late, but when they're in such a pickle because they've tried everything and it's just a lot of this is not intuitive. So if you're a caregiver listening, the way you communicate and the way you support someone with any form of dementia is often not always intuitive. And we often think in a very linear, rational way. And when that function isn't working as well with people with the dementia, we have to dance and interact differently. And I'm so glad to hear that you do have that support, Gary.
Yeah, I'm very blessed. I do. I mean, I have it from you guys. I have it from my family. So, I mean, I'm pretty lucky in that case, where that's another reason why I do it is so that people, because I get calls all the time, they ask, about the association. Of course, I give them all of our information. And, the biggest thing is people don't realize is there's so much between point A and point B with this disease that there's just a lot of room out there. So you can't give up. It's not like you break your arm. Point A, you didn't have it broken. Point B is broken. Okay, that's really bad. But this disease has so much room in there that, there's a lot of room.
Thank you. Thank you so much for all of those words of wisdom and, firsthand, inside out point of view. Okay, I don't see any other questions. So Gary, I'm going to just go through a few more ending slides. But others, if you have any questions, you can certainly contact the Dementia Society of America and we could answer it that way. So I'm going to share my screen at this point and hope this all works. And I've already gone to the interview. Okay, so we're done with our interview. Oh, why is this not working now? So in this slide, if you're listening in, we appreciate all of your questions, but if we didn't get to them or if you think of some later, please feel free to contact the Dementia Society of America. So the Dementia Society of America, if you're not familiar, is a not-for-profit organization. It is chock full of support information for care providers, people living with dementia, and professional providers. And I'm going to see if there's one more. No, not one more question. Okay. And if you feel so inclined, feel free to support. We would love to have that happen. And I want to thank the Dementia Society of America, as always, for hosting this Dementia Unplugged, allowing me to share this, I think, important information with everyone. Okay. Thank you again. Hello again. And Gary, you're getting lots of comments through the chat that there are a lot of thanks for you taking the time. You're an amazing man. What else do we? Thank you for sharing the journey. Thank you, Lee. And thank you for the Dementia Unplugged series. So I appreciate the thank yous. And if anyone has other suggestions or thoughts, please do not hesitate to get a hold of me. You can do that through the Dementia Society or through my own website called dementiacoachoncall.com, dementiacoachoncall.com. With that note, Gary, I wish you only the best, and I'm sure we'll be in touch.
I'll see you at our next meeting.
Okay.
Thanks. Take care. Bye-bye.
Bye.